Assalamu alaikum. Good morning, everybody. Thank you for the introduction. And welcome, everyone, to this session of oral abstracts. Our first presenter is Dr. Sultana Abdulaziz, well known to all of us. She's the Senior Consultant of Rheumatology at King Fahd Hospital in Jeddah, and she's also the Director of the Rheumatology Fellowship Training Program at KFHJ. Dr. Sultana will present on correlation of disease activity scores and the RAPID-3, which is the routine assessment of patient index data in rheumatoid arthritis patients.
Thank you, Dr. Manal, for the introduction. Today I'm going to speak about a paper that is the correlation of disease activity scores and RAPIDs, which is the assessment of patients' index data in a multi-dimensional health assessment questionnaire. Next, please. The background is the assessment of disease activity and functional status are gaining utmost importance in the management of rheumatic disorders. Routine assessment of patient index data, which is the RAPIDs, is an index without formal joint count assessment. It's a patient-centered, effective way of monitoring patients with rheumatoid arthritis. The aim of the study was to analyze the correlation of RAPIDs and disease activity scores by the DAS28 ESR, the DAS28 CRP, the CDI, and the SDI in patients with rheumatoid arthritis attending a single rheumatology center in Jeddah. It's a cross-sectional study. Rheumatoid arthritis patients fulfilling the ACR criteria of 210 criteria for the diagnosis of rheumatoid arthritis were included. From June 2018 to November 2019, data was collected from medical records, including the demographic information, comorbid illnesses, concomitant medications, laboratory tests, and disease activity scores. The validated Arabic version of the multidimensional health assessment questionnaire, which the MD-HAC, was used during the visit by the patients, and those that couldn't, weren't able to complete it was with the help of the patient educator. The RAPIDs, it's the, which includes 10 options, which includes the functional part of the, including physical function, pain is included, as well as the global assessment. It's a total of 30 score, and it is given as remission when it's less than 0.3, and from low disease activity from 3.1 to 6, and moderate disease activity from 6.1 to 13, and high disease activity, it's more than 13. The statistical analysis was done by using the SPSS24. The statistical analysis, we use the frequency, percent, and standard deviation was carried out for the demographic and clinical variables. Differences between the categorical variables, which is the remission, mild and moderate, and the high disease activity, was used by the person's chi-square test to ascertain the relationship between the scores for each method. We used the person's correlation. The coefficient was used to ascertain the strength and the direction of the relationship between the scores for each method used to assess the severity of the disease. Logistic regression was used for adjusted age, gender, and years with rheumatoid arthritis and disease activity. And the p-value was below 0.05 as considered as significant. This is the demographics showing the median age was 53, and the females were 90% of the patients. The standard deviation for the disease duration was 8 years, and the mean BMI, it showed that more than 50% were obese more than 30 kgs. The anti-TNFs that we used was 49%, and those with the JAK inhibitors, 8 patients, that was a total of 6%. Non-TNF inhibitors was used in 39%. Next, please. The disease activity of rheumatoid arthritis was seen that the mean was in the RAPIDS-3 was as well as the DAS ESR, DAS CRP, as well as the CDAI and this SDAI were all of moderate disease activity. Sleep difficulties was seen about in 33%. Anxieties was seen is about 41%. Depression was reported in self-reported by the patients in 28%. The relationship of RAPIDS disease activity scores with the DAS-28 ESR as well as the CRP and CDAI, all of the parameters showed that there was a significant relationship with RAPIDS-3. A scatter plot showed that the linear regression between the RAPIDS-3 and the disease activity scores was all strongly positive, and the best of them was the CRP, DAS CRP, the CDAI, as well as the ESR. And the least of them was the DAS ESR. The Pearson's correlation coefficients of dependency of the RAPIDS-3 with disease activity scores, it showed a relationship. Here, the R coefficient is recorded as -1 to +1. And the 0, it shows that there's no correlation. In our study, it shows that DAS-28 CRP was the best strong correlation, followed by the CDAI as well as the SDAI, and the least was the DAS-28 ESR. In conclusion, we saw that the RAPIDS-3 significantly correlated with the DAS-28 ESR, the CRP, the CDAI, and the SDAI in our patients, as stated in previous studies. It is a simple, non-expensive, patient-centered, practical tool to assess disease activity, reflecting the health quality of life for patients that can be easily implemented in daily life. Our limitations for our study was small sample size, and patients elderly or uncooperative, they needed assistance to do it. Recommendations, it is a patient-centered, helps into a tight control of disease with no blood fluids that are involved. It can be easily be used, especially during our virtual clinics. And in fact, during the shutdown, we interviewed a patient using the RAPID questionnaire. With this, thank you.